Hi friends, I'm Scott Giles, minister and hypnotist, and welcome to Power Talk, my video blog where I cover topics that interest me, focusing on how you can use the power of your mind to take control of your life. If you want to know more about my professional work or sign up for my free e-newsletter, Power Lines, check out my website, which I'll tag in the description. Well, today I want to discuss a universal experience in this age of open medical records. Most of us work with medical professionals who use electronic health records, and most of these record systems have a patient portal that allows you to see lab results and scan results directly upon delivery, often before your physician has even seen them. Well, the result can be a lot of unnecessary worry, as you have to know how to read these things in order to understand what they mean. Something may sound serious when it isn't. My thinking on this was inspired by an article in the Washington Post by Michael Seekers, MD, on August 26, 2024. The good doctor is an oncologist, and he reports the story of a patient who showed up at his medical office without an appointment because he had seen the result of a CT scan that appeared on his patient portal. He had seen the result before his physician had, and he had no idea what to make of it, and he was scared. Now, had he waited to view those results until he was with his trusted physician, he would have been given reassurance and told there was no need to panic. Instead, he spent days in panic. The writer is concerned that modern technology allows us to often see the result of our medical tests in an unfiltered way, and this may not be the best thing for our overall welfare. Now, on one hand, we can see such patient portals as a victory for transparency, and they are. Believe it or not, it used to be common practice for physicians to withhold medical information from a patient if they thought the patient was better off not knowing. This is still true, I believe, in some Eastern European countries. On the other hand, open and full disclosure in an unfiltered way can generate a lot of needless worry. Reading the results of a scan written in carefully parsed medical jargon, or looking at the numbers on a test report without any background in what they mean in the context with other results, will inevitably result in misunderstandings. I recall visiting a personal friend who had been diagnosed with breast cancer. That's scary enough. But her scan report also noted an irregularity in her liver, and she was in a panic state, convinced her cancer was spreading and feeling sure she would die soon. She was planning her funeral, made an appointment to do her will, and so on. Now, having worked as a medical hypnotist for 4 decades with a specialty in oncology, I know how to read these reports. So I looked at the report and immediately saw the wording where the radiologist noted that the irregularity was almost certainly a cyst in the liver. These are benign and common in older people. But my friend didn't know that, so she hit the panic button. In fact, she had an early stage cancer that was one most oncologists consider essentially curable. As the writer points out, not all abnormalities are important. We're all different. A lot of us have abnormal configurations of the organs in our body simply because of our genetics, and that's normal for us. The radiologist or pathologist may use scary language such as further testing may be needed to rule out malignancy, because they're doing that as a way of the hospital covering its behind in the 1 in a million circumstances where the results are actually significant. But a lot of values that are out of range or scan reports listing areas of concern are nothing. And scans or x-rays of various kinds aimed at one part of the body may identify something unusual in another part of the body that isn't the focus of concern. Most of the time, these things are not important, but they'll get mentioned in the report. In medical jargon, these are called incidentalomas, incidental findings that, on close examination, are almost always unimportant. Now, occasionally, these findings are important, which is why it's important that your doctor read the scan report. But for us, if we don't have medical knowledge, we can't filter that appropriately. This is the problem with the increasingly popular whole body scans that some private companies are offering. I get a couple of mailings every year urging me to sign up for such scans. Well, if you do one of these scans and everything comes back fine, well and good. But there is a significant chance that such scans will turn up something abnormal, because most of us have something abnormal, which very likely is not important. There may be a genetic malformation of an organ. It's larger or smaller than usual. There's a nodule in the lung, which are probably benign, as the vast majority are. The problem is that once something shows up in a scan, the physicians now need to check to be sure it's nothing, because they'd be legally liable if they didn't. They may be 99% sure it's nothing, but they have to practice defensively, and they will order more tests. These tests may be expensive, invasive, requiring multiple and unnecessary applications of anesthesia, or additional scans, which can mean absorbing more radiation. Heck, sometimes there is a finding of an actual problem, but one for which, for other reasons, is not a concern for a particular patient, although an unscrupulous medical provider, and they exist, may try to scare you into action that's not in your best interest, but which is profitable for them. For example, in the last few months of his life, my father, who was dying of emphysema, was also found to have prostate cancer. As it happened, his particular sort of prostate cancer was very small and slow-moving. Therefore, everyone knew that he would have died long before the cancer would ever cause him a problem, because a cancer of his sort isn't going to be a problem for something like 20 years. The idea of treating it was insane, and his weakened body would only be further weakened by invasive tests and surgery. But because the cancer had been found, and because they were being seen at a private hospital owned by doctors, he and his wife were bombarded with phone calls from the hospital trying to get him to come up for prostate surgery, even though he was an end-stage disease with emphysema and had only a few weeks to live. They were doing this because in the United States, hospitals make their money by doing procedures. Therefore, there is an economic motivation to do as many procedures as possible, even if they're unnecessary, or as in my father's case, unwise. All of this is by way of saying that unless you have medical knowledge, it's probably a good idea not to read the results of medical tests on your own until you're in the company of a professional who can explain them to you, or that you will be in the company of such a professional soon. Otherwise, you may find yourself chasing smoke and mirrors. This is the same reason I tell my clients not to spend time on the internet reading about their medical problem, because most of the information that is publicly available will be outdated. Pharmaceutical companies and research facilities hold their recent results confidential. Only their approved providers have access to that. You will not have that. And making decisions or thinking worrying thoughts on the basis of outdated information is foolish. So be smart. If you have the information to understand what you're reading or have access to someone who does, then go for it if you want. But if you don't, you will save yourself a lot of pain and worry if you hold off until you're with someone who can tell you what those words and numbers actually mean. Hey, thank you for your time and attention today. I'll be back next week for another talk on a different subject. I'd like to invite you to join me. It helps me a lot if you tell others about my videos, so please like, share, and subscribe, and hit the notification bell. If you're wondering if I can be of help to you, feel free to reach out through my website for a free no-obligation screening call, and we'll talk about it. Have a great week.